Okay, now you're ready to turn and set the wedge. You're always going to get a much better set when the patient is fully straight and parallel to the bed and closer to one side. Bend the knee and turn them over. Now the wedge can be set under the underpad, but for demonstrative purposes, we're going to set the wedge over the pad. Because when you do that, it's a lot easier to see where you're setting the wedge and where it's going to lift from the body, and it's a lot easier to get it under her. Notice how Lisa tucks it under. That makes it a lot more stable. And when she rolls back, the wedge is all the way underneath her and she's resting on top of it. It doesn't work to try to punch the wedge closer once the patient's laying on top of it. So if you want the wedge closer, you'll have to reset it. Setting the wedge to lift from the buttocks and scapula is best when the patient can rest supine, and it mostly circumvents the spine and the coccyx. Here is a standing view of how to set the supine resting wedge. If the patient must rest in the head of the bed greater than 30 degrees, then it's better to set the wedge a little bit lower so it's lifting under the sit bones and the back, just about like this. Or if you're trying to avoid a large wound, you have a heavier patient, or they won't let you turn their back, you can set it very low so that it's lifting only the hips. When side turning is not possible for whatever reason, you can put a wedge on both sides, although this is more difficult and it doesn't achieve complete pressure relief. Okay, so now that you've set the wedge where you want it, roll the patient back so that she's resting on top of it, and you can stand at the edge of the bed to make sure you've got the 30-degree angle that you're looking for. What's next, Kristen?
And you can see there's a lot of weight still on here, so we're truly not offloaded. So what we're asking you guys is to make sure is to, as soon as we bend that leg, you've offloaded the weight. So you can either bend the leg and they can keep it that way, you can use it, or you can use a pillow to support. Like that, and you can, even if you have the leg fairly straight like this, you've still got more offloading than if it was on the ground or on the bed. Ideally, you have it just a little bit forward so that you're in a good alignment. All right, so we also want to make sure we place the heel bed, so we'll go ahead and raise up the legs, slide it under. Ideally getting the ankle area heel into the groove of the heel bed.
Okay.